Hey y'all, my name is Christopher Ray, and I'm a student at Grand Canyon University, and my instructor is Carlissa Wise, and today is February the 8th. Today's presentation focuses on assessment, intervention, and ethical decision making in mental health social work practice. Throughout this course, we have examined how social workers assess and respond to a range of mental health diagnoses, while considering the broader biological, psychological, social, and cultural conditions while avoiding overly symptom-focused or reductionist approaches. That comes from the American Psychiatric Association in 2020. This presentation will review medication-based and non-pharmacological interventions across major diagnostic categories, highlight ethical responsibilities outlined by the NASW Code of Ethics, and examine the limitations of medication using trauma-related disorders as an example. Anxiety disorders. Anxiety disorders are commonly treated with selective serotonin reuptake inhibitors, also known as SSRIs, which are considered first-time medications. Examples include sertraline, brand name Zoloft, and escitalopram, brand name Lexapro. These medications work by blocking the reuptake of serotonin in the brain, increasing its availability and improving mood regulation. Secondary medications include buspirone, brand name Buspar, which acts as a serotonin 5-HT1A receptor partial agonist and carries a lower risk of dependency. Tertiary medications include benzodiazepines such as apralizam, also known as Xanax, which enhance GABA activity but are generally recommended only for short-term use due to the dependence risk. That comes from Gray 2024. An effective alternative intervention is cognitive behavioral therapy, which addresses maladaptive thought patterns and avoidance behaviors. Research consistently demonstrates that CBT produces long-term improvement in anxiety symptoms without the risk associated with long-term medication use. Bipolar and mood disorders. For bipolar and mood disorders, primary pharmacological treatments include mood stabilizers such as lithium carbonate, which stabilizes neuronal signaling, and valproate, brand name Depakote, which increases gamma aminobutyric acid, or GABA, in the brain. These medications reduce manic episodes and mood instability. Secondary medications include atypical antipsychotics such as quetiapine, brand name Seroquel, which block dopamine and serotonin receptors. Antidepressants may be used cautiously and typically only in combination with mood stabilizers to prevent manic switching. That comes from the American Psychiatric Association in 2022. An effective alternative intervention is interpersonal and social rhythm therapy, which focuses on stabilizing sleep-wake cycles and daily routines. This approach has been shown to reduce relapse rates by improving circadian rhythm regulation and interpersonal functioning. Personality disorders. There is no medication that directly treats personality disorders. Instead, pharmacological interventions target symptom clusters such as mood instability, impulsivity, or aggression. SSRIs such as fluoxetine or Prozac may help regulate mood, while mood stabilizers like lamotrigine, brand name Lamictal, may reduce emotional dysregulation. Low-dose antipsychotics such as risperidone or risperidol may be used for severe impulsivity or aggression. It comes from the American Psychiatric Association of 2022. The most effective intervention for borderline personality disorder is dialectical behavior therapy, also known as DBT. DBT focuses on emotional regulation, distress tolerance, mindfulness, and interpersonal effectiveness, and is strongly supported by empirical research. Schizophrenia spectrum disorders. Primary medications for schizophrenia spectrum disorders include first and second generation antipsychotics such as risperidone and olanzapine, brand name Zyprexa. These medications work by blocking dopamine D2 receptors, reducing hallucinations and delusions. Secondary options include long-acting injectable antipsychotics, which improve medication adherence. Tertiary treatment includes clozapine, also known as Clozaril, which is reversed for treatment-resistant schizophrenia due to its serious side effect profile and requires blood monitoring. Alternative interventions include psychosocial rehabilitation, supported employment, and social skills training, which significantly improve community functioning and quality of life. Trauma and adjustment disorders. Primary medications for trauma-related disorders such as PTSD include SSRIs such as paroxetine or Paxil, and sertraline or Zoloft. Prazosin brand name Minipress is often used secondarily to reduce trauma-related nightmares by blocking alpha-1 adrenergic receptors. While medication may reduce symptoms like hyperarousal or sleep disturbance, it does not process trauma itself. Trauma-focused psychotherapy such as trauma-focused CBT and EMDR are considered first-line treatments because they address traumatic memories directly and support long-term recovery. NASW ethical responsibilities. The NASW Code of Ethics emphasizes social welfare, public participation, public emergencies, and social and political action. Social workers have an ethical responsibility to address issues such as overmedication, pill mills, and pharmaceutical influence while advocating for informed consent and access to non-pharmacological treatment options. Ethical practice requires balancing medication use with evidence-based interventions and promoting client self-determination. Limitations of medication for trauma-related disorders. Medication has important limitations in the treatment of trauma-related disorders. While it can reduce symptom severity, it does not address the underlying traumatic experiences that drive avoidance, negative beliefs, and emotional numbing. Some clients experience emotional blunting or side effects that interfere with functioning. Certain medications carry dependency risk and may reinforce avoidance rather than healing. Research consistently shows that medication alone is insufficient for trauma recovery and is most effective when combined with trauma-focused psychotherapy. Alternative interventions, such as EMDR, eye movement desensitization and reprocessing, or EMDR, is a trauma-focused psychotherapy that helps clients reprocess traumatic memories through bilateral stimulation, such as guided eye movements. This process allows traumatic memories to become less emotionally charged and more adaptively integrated. Research demonstrates that EMDR effectively reduces core PTSD symptoms and produces lasting treatment outcomes. EMDR aligns with trauma-informed and strengths-based social work practice by promoting empowerment and long-term recovery. Evaluation of practice and conclusion. Evaluation of practice is essential to ethical and effective social work. Ongoing assessment allows social workers to determine whether interventions are improving symptoms, functioning, and community participation. When progress is limited, social workers must adjust treatment plans, collaborate with interdisciplinary teams, and advocate for alternative interventions. In conclusion, integrating pharmacological and psychosocial interventions with a biopsychosocial framework allows social workers to provide ethical, holistic care that supports long-term recovery and community engagement. Thank you very much for your time.